We have to develop a budget for the upcoming fiscal year that is ultimately approved in late August, early September. The fiscal year starts in October, but we start that process now. So this what you're providing us today is going to feed into that process.
For me, my funding request is some way to engage the clinics in asking kind of through like a survey or just through the questions that they're asking when folks come in for care, really a data collection initiative to better understand what our population looks like.
Funding for diagnostic testing. I see specialty care on here, but a lot of times diagnostic testing is required or needed for patients to get to the specialty care that they need.
Mentioned transportation, which is one factor, but there are several determinants of health, and I'd like to learn more about the plan of Central Health.
In this current year, we anticipate $181.8 million in tax revenue, and we use those funds for healthcare delivery. You'll see also on the right-hand chart on the uses of funds that our administrative expenses are less than 5%. So we use about 95% of our funds on healthcare delivery.
In 2004, there was kind of a crisis in mental health care in Austin, Travis County, and that led to a very big movement that it was time for Travis County to have a healthcare district, that we needed more funds to be able to provide appropriate care for folks. And in this particular case, it was really around a crisis in mental health care. There was not enough availability of that.
Over the course of a year, this budget will support about 45,000 individuals enrolled in the medical access program. So that's the size of the population. Again, that's MAP. We support the care for about 50,000 other folks in the course of a year. So that budget, that $103 million, is supporting care over the course of a year for almost 100,000 persons in the medical access program and in the other programs that we support.
Work for the most recent years, the past 2 or 3 years, has been about building out this extended network. In the past couple of years, we've really grown our urgent care network so that our patients have access to after hours and weekend care. We've grown from 6 urgent care sites in Travis County to, I want to say 19 or 20 at this point.
Over the next 2 to 3 years, what we're working on now is determining how is it that we're going to affect the population and then measure what that value is. Because as this relationship matures, we need to be able to turn around to the community and say, this is how we're improving lives on a large-scale basis, but then to bring it back to a finer point, what does that mean for the Latino population in Travis County? What does that mean for the African American population, Native American populations in Travis County, LGBTQ? What does that mean for the population as a whole? But then distill it down even further, as Dr. Hernandez had pointed out, did that patient get the outcome they were looking for? Can they walk their dogs? Can they dance? Can they go to work or do whatever, or take care of people, whatever it is that they're looking for in their ultimate outcome? So